Thank
Yeah,
you, Dr. Aishnavi and
Dr. Vaishnavi. She is the new host for Hindi session also.
Yes, sir. Yes,
So
sir.
she will be taking some of the sessions, and she is a good.
We are very happy to have such wonderful moderators for our session. Welcome, Dr. Vaishnavi.
Thank you so much, sir. Thank you so much.
Thank you, Dr. Vaishnavi, Dr. Manish, and Sahani sir. Good evening, good afternoon, and good morning. This is the 1448th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session. Today, our guest is Dr. Kalyan Swarup. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over. The Hindi session from 7:30 to 8:30 and 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. All these sessions are going in good way, and we are about to reach 4,550 at the day within 2 days. So that's a very another milestone we are about to reach. And today, let me introduce our guest of the day, Professor Dr. Kalyan Swarup. Doctor has completed a DMS from Calcutta. He's a retired professor, Department of Practice of Medicine, Gaya Homeopathic Medical College, Gaya, Bihar, and has done a lot of lectures in different parts, and the lectures delivered on taught at Government Homeopathic Medical College, Faisalabad, Uttar Pradesh, Government Homeopathic Medical College, Kanpur, UP, and he is an author of many books, and particularly The Diseases of Nail, God of Homeopathy Philosophy, AC Materia Medica. And the doctor has completed more than 45 years of clinical experience. That means a wonderful person in front of us, and sir has delivered some presentations both in our Hindi as well as in English sessions earlier. So today, Doctor will be discussing an important subject, that is the value of hereditary in homeopathy. That's a great subject, and it's going to be one of the best to be watched. And let us proudly welcome the guest of the day, Dr. Kalyan Swarup. Welcome, sir. You can share the screen and begin the session. You are co-host now.
Hello.
Sir, you can you speak now because you are.
I am audible?
Yes, definitely. You are audible.
Oh, okay. So I am thinking I am audible or not.
Yes, you are sharing the screen or not?
Not I will share the screen.
Okay.
Directly I am talking with the mobile.
Okay. Sir, you may continue. You can begin the session now, sir. Welcome.
Thank you, sir. Thank you, sir. Respected all homeopathic physician. Here I am Dr. Kalyan Swarup from Gaya, Bihar. Before starting my topic, I want to say something with you. A horse without horse rider never reach a fixed place where should go. But a horse with horse rider must reach the proper place where should go. So being a homeopath, you must be follow the rule and regulation which is guided by our master, Dr. Hahnemann, Dr. Herring, and Dr. Kent. We not run without the principle. One of the renowned doctor of Calcutta, Dr. S.P. Day, very renowned person of the Calcutta, and he was my teacher, who say homeopathic treatment without following the rule and regulation is just like the appreciation of shape of an elephant by touching the portion by the blind man. So, without principle, without guideline, you never cure a single case in your life. You only can suppress the disease, but never cure. You must follow the cardinal principle of homeopathy, law of similar, law of simplex, law of minimum. So I request to all homeopaths, first you follow the principle, then you start your treatment. They will get you your success in homeopathic science. Now I come, my topic is value of heredity in homeopathic science. During the treatment of any chronic disease, we take the full history of the patient. We also take the family history of the patient. In family history, we try to know about the brothers and sisters, mothers and fathers, grandmother and grandfather, both sides of the family, from the maternal side or the paternal side. We asked about any grievous disease to which the patient is suffering from. If death of the family, we try to know from which disease he or her died. By this point, we come in the conclusion of the heredity relation of the disease to the coming patient in my clinic. There are some diseases which detect the family history, like the leukoderma, cancer, cardiac disease, rheumatic disease, tuberculosis, or asthma, so and so. So, heredity has an important place in the treatment of chronic disease. Sometimes, also in acute disease, we take the family history. Our main guide for the treatment and cure of the disease are miasm, like sora, syphilis, and psychosis. Diseases are nothing but an outward come from the understanding cause which exists in the very man himself, with his heredity on the background in the form of sora, syphilis, and psychosis. It is also absorbed that the symptoms of the disease differ according to the different constitution and the characteristic individuality of the patient. Heredity is one of the most important factor in the heredity. Just as no two leaves on the tree are exactly alike, so no two women are just alike. Even the so-called identical twins who arise from the same fertilized egg are not exactly alike, as an inspection of the fingerprints will show this. The same is the case of treatment with the homeopathic science. We have to know the difference between one man and the other man. there is no doubt that our body is composed of cells, tissue, ligaments, muscles, nerve, blood, so and so. And they have a huge, their future is our body, not as a master, but as a servant. The man, his will and understanding are the prime factor. So each man on the earth is different from the another in will and the understanding. Through the physical appearance, most of us are almost alike. But as a homeopath, we are not concerned with mechanism, cell, tissue, chromosomes. In the part of disease, we always guide by the man. So there is one question arises. What is man? Man is an invisible power which lived in the valuable body. Which are you singing from the outside? There is 2 hands, 2 legs. This is not a man. Man is an invisible power which lived in the visible body. So being a homeopath, we should try to collect the symptoms from the inner man, not from the outer man. So inner man means his desire and aversion and general symptoms we collect by the inner man. The mind and the intellectual side. Dear, may live by the generation, and homeopathy depends on the heredity based on the mism. So be homeopath, according to Hahnemann, believe on the mism and treat the patient according to mismatic ground. The mism are present in each and every family in the form of sora, syphilis, and psychosis. But everyone is soric person. Everyone is susceptible to disease. And it is the sora which pollute the mind, the man, and the generation. Such, since the beginning of the world, sora has effect from the human race. As sora affected the human race, there was birth of disease. It is the spiritual sickness for which the first state of race progress into what may be called the true susceptibility to sora, which is turned like the foundation of the other disease. So-called sora is the mother of all chronic diseases. So the birth of sora means susceptibility to disease which comes as a result of mental pollution. So if there was no sora, the other two, psychosis and syphilis, will not enter the human body. Due to bad thought and poison by the infected person, this traumatism comes in our body. So long as there was no sora in the world, is stable in the order. Dear, so every psychotic patient suffering from the anemia, in some cases, blood is not affected by the psychosis, affected to the mucous membrane and soft tissue with marked indifference of the affected part. There may be lateral affection of the eyes lateral affection of the ear, nose, and also the throat. The psychotic patient is heterogeneous constitution, so easily suffered from the sneezing, coryza, ear discharge, and otorrhea. In the cantal condition is suppressed, it affects to the vital organ as a stomach, intestine, liver, lungs, kidney. It may affect the joint, produce rheumatic and gout symptoms are very common. At that time, if the marriage, a healthy human, previously with the no psychotic symptoms, the latter become liable to menstrual disease as dysmenorrhea and affection of the ovary, uterus, and the fallopian tube. A wife is generally infected with the same character and the form of disease which the husband generally suffered from. So the woman is in the worst suffer, and innocent wife may suffer from organic affection of the blood, bacterial troubles of the eyes and ear and the nose, and also affected the joints of the body. Sterility is common psychotic omen. This type of suffering of ill-affected life prolonged. Women also contract psychosis from their parents also. Psychosis very commonly makes the woman sterility, or if she had a few child, you will find in her a strong tendency to marasmus in the first year of the baby. So child with psychotic heredity suffered from the rickets, infantile liver, diarrhea. After a constipation and diarrhea alternate, cardiac disease, respiratory disease also suffer. If no psychotic treatment is done, then dentition is late. The child is late learning to walk, late learning to speak, has no development of dull and idiotic character of the person. There may be enlargement of the gland in the neck or axilla or the groin, enlargement of the tonsil with the marked susceptibility to the cold. The child may suffer from the pneumonia, bronchitis, asthma, and meningitis. Otorrhea is very common in psychotic child. Polyps growth also found in the psychotic child. Puberty is psychotic girl come late. Menstruation come late. There is mental weakness, physical sign of puberty seen late. The girls may be suffering from the leukorrhea, menorrhagia, may be suffering from joint pain with menstrual complaint. Psychotic patients are very nervous, over anxious, hopelessness, sometimes thinks to commit suicide, but lack of courage, not done this, just like Naxvomika. The patient is suspicious nature. She suffered till the last breath of her long life. Another miasm which affect the mankind is some manner as psychosis, is syphilitic. Syphilis also comes as a result of impure sexual contact. Man is affected by it practically with consciousness. In heredity, syphilis occupy a very important place. A man with a history of syphilis without any treatment, marriage healthy wife had infected her. As the result of marriage, she suffered from repeated abortion, or if any child survived, he or she is black with the syphilitic miasm. Syphilis infects the child in the embryo. It goes to the inner nature of the man in his intellect, will, and the understanding. If his wife born a child is fat, flabby, but weak, with the defect in bone, softening of the bone, and enlargement of the gland all over the body. They are let embryos expect to take off, play, and walk. Ricket is the most common disease during the teething children. They suffer from the epilepsy, infantile liver, sore throat, hunching teeth, enlarged tonsil, chronic hoarseness. There is suicidal tendency, no fear during the time of suicide. So, Dr. Kent, in his Materia Medica, write, in complete tuberculosis, in the chapter of tuberculosis, Dr. Kent writes, it is true that phthisis means lungs tuberculosis and insanity are the controversial condition. The one falls into the other. Many cases that are treated and cured, and phthisis of the lungs has just been turned aside, finally become the insane. Person who have been cured by the insanity go to the phthisis condition, and finally the patient die. In Kent Materia Medica, the view of the Dr. Burnett that ringworm commonly fall upon those who had inherited phthisis. So which person is suffering from the tuberculosis must be the chance of suffering from the ringworm. No doubt there is no. So when any person come to you with the ringworm, must you ask from the patient, there is family history of the tuberculosis, or the patient is suffering from the tuberculosis? He thought was a sign of approaching phthisis. That was a very common feature of those who have inherited phthisis. And he used the Bacillinum 200. This is written by Dr. Burnett, and Dr. Burnett prescribed in case of the ringworm, there is a history of the tuberculosis. Burnett start from the 200 potency. He used it somewhat as a routine remedy on every child with the ringworm. You read Elensky note, tuberculinum. When with a family history of tubercular affection, the best selected remedy fell to relieve or permanently improve without reference to the name of the disease, you can give tuberculinum or bacillinum. So, the treatment of psychotic group of patient is more difficult. Psychotic patient never give the clear-cut indication during the case taking. Most of the symptoms, they don't like to describe with the physician. Psychotic patient is very suspicious nature. Always keep suspicion on the doctor. They think doctor is not proper hearing my matter, which I want to say to him. He always repeat his symptoms with you, but never say the more important symptoms which help for the selection of the proper remedy. Psoriatic and syphilitic don't do this type of work. Mole or warts is the precondition of the cancerous. So please, with request, I am telling to you that you never try to cut out your mole or the warts by any method, maybe change or turn into the cancerous growth, cut injury of the warts and the mole. You treat homeopathically by the potentized medicine that will help you and cure that. Never try to cut off by any method of the treatment. We see today how people have lost their self-control, how selfishness are ramped everywhere. This is due to psychosis and syphilis, which break the mind from the generation to generation. The communicated right is the burning example of this affected miasm. We have forgot to behave politically. We are quick-tempered and irritable at the slight provocation. Just we are seeing the neighbor country, because syphilis is very cruel nature, always want to harm to the other, not like to peaceful in anywhere. Today, most of us are nailing interest in the sexual matter and desire great pleasure from the sex story, sex poem, or sex magazine. The present day producer and director of the cinema world are also taking full advantage of the situation. They are profoundly tired of the cinema in the public. Most of the song of this time is very rough. You cannot hurt with your family. They are all victims of the psychosis and the syphilis, which they have inherited from the generation to generation. During the treatment of this type of hereditary disease, must follow the constitutional treatment or the classical treatment. Most follow the complete guideline of Dr. Hahnemann. Selection of remedy must be thing which done work in the deep action. Potency of the remedy must be above 200, 1 m, 10 m, cm. Because this type of treatment, if any symptom disease comes that leave you, never give any remedy for that, do harm your patient. First, you collect the symptoms, mental symptoms of the patient, general symptoms of the patient, and the particular symptoms of the patient. Your main aim to select most of the general symptoms and the mental symptoms. Then you got cure. Cure means removal of the symptoms, the restoration of the health. Only the symptoms is not called cure. One thing I also want to say you that syphilis in the father, tuberculosis in the son. If any parents suffering from the syphilis and he got born a child, you must know, you try to know, his child must be suffering from the tuberculosis. The inherited of a stage of syphilis is tuberculosis. Any disorder in the childhood must have its reason in the parents, because nothing can be self-acquired at such tender age. A father contracts syphilis and we get a son. The son must be have the tuberculosis. The father commit the sin, but the son is suffering from, the child suffering from the sin of his father. I was saying, right in the material medical year also, I do say in the circumstances, a dwarfish child is born generally in that family where is dwarfish found. So this is the hereditary condition to born this type of child in that family. A brilliant child born in the tubercular history of family. A family is suffering from the tuberculosis, the history of tuberculosis, you must see that child, his child must be very intelligent. So the tubercular parent child, very, very intelligent. Mostly the syphilis suffer from the born. So syphilitic patient, the history of syphilis in the family, the child is suffer from the deformity of the body, deformity of the throat, cutting of the throat, cutting of the lip. This type of thing you find in the patient. Here I am saying to you a case history. A patient come to me 30 years before, not today case, 30 years before. The name was Bela Kumari, age about the 6 months. What was the complaint? The complaint was when the patient cried, his whole body became the black. And due to the blackness, her family thinks the child is going to be die. And I start to take the breath from mouth to mouth to the child. At that time, before coming to me, the patient go to the Patna, a renowned cardiologist, Dr. R.K. Agrawal. Dr. R.K. Agrawal say there is hole in the heart. So in this age, his age is 6 months. After 3 years, I can operate this child. And it is impossible to do anything this time. A homeopath doctor referred to me. The child come to me. The child come with mother, uncle, and grandfather. His father not come with the child. I collect several points from the patient, not from the child, from the mother of the child, because child will not say anything. And once time I have seen from face to face, during the crying, his face became very bluish color. I come in contact and give some medicine which come from the case taking. But there is problem with me. What I want to know, that is not collected by his mother or the uncle or the grandfather. After 3 or 4 months, his father come to me and he say, sir, please give me the medicine of Bela Kumari. I asked, who is Bela Kumari? He say, sir, he's my doctor. I come from the chamber, seat chair and outside. And suddenly I asked to them, dear, you can tell me, have you suffering from the gonorrhea in any stage, any time? No chance of thinking to the patient. I suddenly asked to him. His father say, sir, before marriage, I was suffering from the gonorrheal discharge. And that is suppressed by the injection or every medicine by the allopathic science. I come in conclusion that a patient may be chance of cure. And I take the help of medicine is medorinum. I think after 3 to 4 months get relief by something. And after 1.5 years, the medicine is not taken by him, patient is get cured and no need of the operation to the patient. So homeopathy can do if the person say about the family history, if the person is complete set to heredity, then the homeopathic doctor help to him, no doubt. Second case, I am telling to you, a aged girl, married girl, who come my clinic, and there is history of several time abortion. 5 or 6 abortion has done. One child born in the full term, but after born, within 1 hour, that she just died. His father is consult to me. I say, I can take your case, but promise is that before pregnancy, I will take this case. He say, I go to the AIMS, Delhi, and he say, your child will never survive. You cannot be a child. Okay. He say, but I am saying, before pregnancy, you come to me, I will take to help you. Please, I am don't saying to this thing, very close person is them. After treatment, I have complete treatment 2 years. Within 2 years, the patient get pregnancy. And after full month of pregnancy, she got a baby child. And now the baby child is aged about the 1.5 years. He is very good. No any healthy problem. Come and quiet, very right, and get success by the homeopathic treatment. So homeopathic can do very result, good result with every patient. If the patient help to me, if the patient help to the case taking, my case taking must be the clear cut indication. One case I am also telling to you, a case of asthma, a renowned physician of the Gayaton, his relation, he is an engineer. Now he is working in the Hyderabad. 35 years before, I have taken this case. There was a suppression of history of a skin disease. I have taken this case. Treatment has started. More than 2 years I have taken. Now he is working in the Hyderabad, and no any problem come up within the 35 years. Very okay, very healthy condition, because he is a local person and mostly he come with family to me, and I only ask to how is, well, he is a very fine sir, no any problem come with who. So dear friend, being a homeopath, I am telling to you, if follow the principle, you follow the case history, you read a book written by Dr. Neel Mani Ghatak. The name of the book is Chronic Disease and Cause Its Cure, written by Dr. Neel Mani Ghatak in Bangla, translated by Dr. P. Banerjee. You go, the page number 135 and second paragraph, you say, here is right. You can charge high and high fee, but don't do cheap and the hasty work with the patient. You demand your fee. Never do hasty and worky work. Nowadays, we homeopath is doing, we are seeing several and several patients, more and more patients want to see. But the principle is not adopted by the alls. So this is the very bad condition. Being a homeopath, I am practiced from the since 50 years, lagbhag. I am completed my education in the 78 from Calcutta Homeopathic Medical College. Since I seen that, I am starting my practice. So within this, I have seen mostly the doctor is not adopting the principle. And so he say, I am going to cure the patient. No, dear friend, frankly, I am saying to you, if you not follow the principle, never cure a single case in your life. You can suppress the patient. Patient will be happy. You will be happy. You can charge medicine. You can earn the money, but never cure the patient. And this is the misguided by the physician to the homeopath or the patient who have faith in the homeopath, who have faith in the doctors. He come with the faith. So I am losing the faith with the patient. So this is the lecture. Heredity and heredity must be collected in every chronic case. Without any chronic case, must be collected the case history. So case history is the half cure. Several doctors say best case taking means the half cure. So half cure done by the case taking. So better knowledge have the materia medica, organon and principle. You get many. Thanks to all.
Thank you, Professor Dr. Kalyan Swarup. It's really a very good session. You really covered the subject in a beautiful way with some 3 cases, and all the cases you demonstrated here was really brilliant. And why a physician need to look into the case, and why simply patients used to visit us and say that, doctor, I have a case of, I am having pneumonia. But whether it be a pneumonia or bronchitis, whatever may be the case, you need to get into the case and find out what is the reason behind the illness and how it developed and how it transformed into the present situation. And then you will get the symptoms Otherwise, you just get the symptoms of the present situation. That is the pneumonia, as you all know, that is the symptoms of the pneumonia: chest pain, regular cough, intense cough, excessive food inside, and may come or come out, may not come out with severe fever lasting long time. But these are the symptoms of pneumonia. But as far as the homeopathy is concerned, you can diagnose the case it as a case of pneumonia, but choosing the right remedy is entirely different. Whether the patient is having pain on the right side or on the left side, that depends, and whether it is the result of some other means of suppression. Of course, sometimes patients may having skin problems, and might have been under the treatment of some other allopathic doctor or some other person who is having who has given some antibiotic as well as some other steroids for that, and thereby suppression may happen. And as a result, as far as the other side of people are concerned, they are not much worried about all those things. But when we get into when we take the case in detail, we may find such things behind the illness, and we will have to go into the depth of the case, whether it is an acute illness or whether it is a chronic one. So whether the patient is at the present condition is in a soric state of psychotic phase or even a syphilitic case, then we can definitely go choose the right remedy and can bring the patient back to normal, and thereby the patient will be cured completely. Otherwise, sometimes if we go in the other method of treatment, it will become a palliation. And so you need to find whether it is a case of palliation or a cure. So the cure and palliations are entirely different, and all those things where you really beautifully describe all those things in your presentation. Anyway, you really deserve kudos for your excellent session in this evening, a powerful session indeed. And I invite all of you to participate in the discussion, and those who want to participate in the discussion can raise your hand so that we will allow you to talk. We will allow you to unmute and you can speak to Dr. Kalyan Swarup. Anyway, congratulations once again. What's your opinion on that, sir? But I just narrated a simple case of pneumonia. How will you trace the case, sir? Follow me or not, sir?
Hello.
Yes, Doctor. Yes, sir. Can you explain something more on that? Because I just narrated a story, a case of pneumonia, and I have given the reasons behind the illness. And how will you trace that case?
If a patient is suffering from the pneumonia, there is history of the exposure to cold. So generally the patient is psychotic patient is suffering from the hydrogenoid constitution. So due to the hydrogenoid constitution means hydro means water. Constitution means constitution. So every person is suffering from the cold exposure, rain exposure. Yeah, due to the dry cold or the dry wet, if the patient is collected. So in case of pneumonia, must you try to know the clinical knowledge also. You must try to know which only the symptoms is not help to the selection of the remedy. You have the better knowledge of the practice of medicine. You use the stethoscope on the chest and see this type of sound coming from the chest. There is rull sound, ronchi sound, or crepitation. If the symptoms is the sound is changed, suppose a patient is coming from the rull sound, you take the help of antimptot. There will be antimptot. So you must help the stethoscope. The ronchi sound is other medicine, crepitation is other medicine, rulls is other medicine. One thing I am telling to you when you are asking about the pneumonia, a wonderful remedy of pneumonia is lycopodium. And lycopodium is a single symptoms in country. In a 4,000 medicine, only one medicine is the pneumonia, written in the bold letter, single medicine. You open the country party, there is wrinkle on the forehead. Never think any medicine within the 4,000. Only one medicine is the lycopodium. If there is gurgling sound, roll sound, you take the help of antim-tat. In LP-tat, you also read the Materia Medica Helensky note. So this type of the selection help you by the collection of the symptoms, no doubt.
Yes, exactly. That's one of the best answers I have heard from anyone here. And that's really appreciate. I really appreciate your excellent answer also. And now it is the time for Dr. Ram Parisar sir to say a few words.
That may be of punctuation. Dr. Kalyan Swarup. I am very happy your presentation. Very good, excellent presentation. Main cause of disease and select of symptom the patient. Main cause of disease, Shora, psychotic and psychiatric, according to law of homeopathic science. But there are two types of disease, acute and chronic. Acute disease, without medicine, expel the symptom. Sudden attack the symptom, without medicine, expel the symptom. Chronic disease, without medicine, not cure the patient. Chronic disease, according to the arithmetic, Sora, psychotic and Sora is the mother of all disease, psychotic and syphilitic. Sora is the functional and Sora background of tuberculosis. It's the name of it. And psychotic, syphilitic. Psychotic definition, extra good the organs, syphilitic, destroy the organs, according to law of mathematics science. But there are two symptoms, subjective symptoms and objective symptoms. Subjective symptom and Sora objective symptom. Sora is other name of thinking. Mental is called name of Sora. And body is name of objective symptom. Psychotic, extra good the symptom, objective symptom. And subjective symptom, intelligence, other and syphilitic disorder. Very, very
sir.
thanks. I am very happy. Dr. Kalyan Swarup. Thank you, sir. Thank you. Very, very thanks.
Yes, if anybody want to say anything to Dr. Kalyan Swarup, you can raise your hand. Now I invite Dr. Ramadevi Ambadi to say a few words on this session. Dr. Ambadi. Dr.
Hello.
Mugli?
Can you hear me?
Yes, yes.
Dr. Kalyan Swarup, it was very nice session. We also used to take this hereditary complaints very seriously. Actually, what you told is correct because the leukorrhea and all these things are seen in children due to even if, to wives. If the husband is suffering from gonorrhea, the wife will be having leukorrheal problems and all their complaints starts after marriage. If they are telling, I used to ask the husband whether you have got any complaint STD and all. I used to ask them, and I will give them medicines. I have got a case. I have to tell one case. One lady was she was 48 years old, and she was since 19 years they don't have children, and all treatment were given to that lady only. Then they came to me. Then I asked these symptoms, and she told that she was having all the complaints after marriage. Then I asked her husband whether you had any STD before marriage. Then he told he was having some this one, and he had undergone treatment. Then I gave him medorinum tenum, and to her I gave actually syphilinum tenum for her 2 doses, and I gave other organ remedies and all, of course, neupharluteum and everything gave, and I asked them not to get pregnant for 1 month. You have to take care. Then after 1 month, I asked them, you try for pregnancy. Then by God's grace, second month she got the pregnancy, and she is having one alive girl baby. Now she is 19 years old. The last week she came. Only 2.5 months treatment I had given her, and she got medicine. Only because of this suppressed gonorrhea, I gave him medorinum, and I got the result. I was remembering when you were taking the class, I was remembering all these cases. Thank you, Dr. Kalyan.
Thank you, madam. You are going to the right path. So your patient must be cured. You are right path, sir. Yeah.
Okay. And now I invite Dr. Bob Lim to say a few words, and then you can say vote of thanks to the session also.
Thank you, Dr. Danesh. I am Bob Lim from Malaysia, and this very good session today to hear from a very, very experienced Dr. KALYAN SWARUP from Bihar. And it's all talking through his experience and from the memory. It's a long time that we hear classical homeopathy from an expert like you. So it is a very, very good session, and I appreciate it very much. And on behalf of the IFPH, we would like to offer our sincere thanks and appreciation to you for sharing tonight's session. Even though there's no slide, but we can understand what is going on and how you present your case is very, very good. And I hope that you will share further of your knowledge and more of your case taking in the next session. And we hope to hear from you soon. Thank you very much. And over to you, Dr. Danesh.
Thank you, Bob Lim. Thank you, Dr. Bob Lim. Thank you.
Thank you, Dr. Bob Lim and Dr. Kalyan Swarup and those who participate in the session. Tomorrow we will have a session from Dr. Geeta Jose, retired principal from Calcutta Homeopathic Medical College, and she will be talking about PCOD and its homeopathic management. Thank you all. Good night. See you all tomorrow at the same time. It is over to Dr. Mariamma John for our next session in Malayalam.